Hello, everyone, and welcome to our webinar on ISO 45003, Psychological Health and Safety Management. This webinar is organized by Ifan, the International Federation of Standard Users. We are thrilled to have you join us as we delve into the crucial topic of well-being and its profound impact on individuals and organizations alike. In our fast-paced and demanding world, it is increasingly important to prioritize our overall well-being, whether we are employees, leaders, or members of our community. Our mental, physical, and emotional health significantly influence our ability to thrive and succeed. Investing in our well-being, it is not only an act of self-care, but also a strategic decision that can yield tremendous benefit to organizations. In today's webinar, we'll be joined by four great, wonderful speakers who will give us their perspective on the issue. We will listen to Ms. Kate Field, the Global Head of Health, Safety and Wellbeing at the British Standard Institute, BSI, who will introduce to us the standard and its benefit. Mrs. Dalia Rome, the Director of Standardization at the Standard Institution of Israel, SII, will discuss the challenges of marketing and selling ISO 45003 training courses. Mr. Chris Sibley, the Head of Safety Operation at Amcor, will talk about the implementation of the standard in his company, and Mr. Chaim Oren, a well-being expert and a podcaster, will introduce us to the workplace and the trends of well-being in the workplace. So let's begin. We will start with Mr. Chaim Oren. Chaim is a well-being expert. He writes and lectures about well-being. He's also a brand ambassador for Hinza Performance, a global leader in well-being and human performance. Hello, Chaim.
Hello, everyone. In the recent years,
can you please give us an overview of what is well-being? Is it a passing trend or a significant trend for here to stay? What are the reasons for its growth, and who are the users?
Hello, everyone. In the past few years, we've been witnessing the rise of epidemic of burnout, mental health problems, depression, and so forth. I'd like just to quote a few statistics about the alarming trends. For example, McKinsey, International Consulting Group, estimated last year that employees with poor well-being are 4 times more likely to leave the company. And so burnout is a very, very significant and alarming trend. McKinsey considered well-being as one of the top 10 trends to impact companies and organizations around the world. Gallup survey last year found out that 4 out of 10 adults report on stress and worries. And so this trend has been exacerbated by the corona epidemic. And so the numbers are increasing since the last few years. What we've been witnessing is that burnout and stress really cause damages that we can, based on research, identify as the higher incidence for strokes, heart diseases, higher level of presenteeism and absenteeism, a declining level of morale, motivation, and loyalty by employees, and of course, high turnover. And so these trends have given the impetus to the rise of the well-being paradigm. And the leading edge companies from around the world have started to adopt well-being. And many examples I can use, companies like Cisco, Google, Microsoft, Adobe, Nokia, and others. And I think one of the most interesting users of well-being is Formula One race. As we know, this is the most prestigious motor race event in the world. Now listen to this. In the past 10 years, 96% of the podium wins, meaning the first 3 places wins in each race, were won by drivers who have been trained by INSA, well-being coaches and trainers. And so world champions like Lewis Hamilton and Sebastian Vettel are staunch supporters and users of well-being, and they've publicly stated that. And so this is an example of how well-being can positively impact the performance of their users. More than that, what is well-being? I'd like to use the definition of the American Psychologists Association. They define well-being as a state of happiness, contentment, with low level of stress, overall good physical and mental health, and a strong sense of optimism towards the future. This definition really captures the holistic aspect of well-being, which includes physical elements like physical health, mental elements, low level of stress, strong mental situation, and even spiritual elements like sense of contentment and happiness. And so well-being, as I said, is picking up very strongly. For example, the size of the global corporate well-being market has been estimated to reach $50 billion last year. And its compound annual growth rate is a very healthy 7%. I think just to end, to capture the growing sense of understanding of the importance of well-being to company organizations, is I like to use the quote of the CEO of Salesforce, Mark Benioff. He recently said, and I quote, "Well-being is not about the absence of stress or about sense of stress. It's about thriving in every aspect of your life. It's about feeling energized, focused, and connected. And at Salesforce, we prioritize well-being for our employees because we know it drives success and innovation." So I think this quote really captures the mind shift among CEOs and senior corporate executives worldwide about the need and importance of adopting well-being.
Yes, thank you. I think it does. But can you give me an example of an leading international company that adopts the trends? What are they doing? How are they using it?
Well, there are many examples, as I noted before, but I think an example that stands out is Johnson & Johnson and their well-being program called Live for Life. They actually launched the program in 1978, so they are considered to be a pioneer in well-being. They defined the vision for well-being is to create a culture of healthy employees. So simple, but still very powerful. And the program really includes three components: minimize diseases, prevent diseases, maximize employee performance, and maximize employee safety. The program really includes many components that evolved over the year, so I'd like just to quote some of them. They launched an educational program to train employees and managers about how to avoid and how to prevent diseases, how to stop smoking cigarettes, really maintain their weight, manage the stress, and other components of well-being. They also launched and built 60 or more than 60 sports centers around the world, and Johnson & Johnson is a multinational corporation, and it has more than 60 locations around the world. So almost every location has got a sports center in order to encourage employees to do sport activities. Also, they've adopted healthy food throughout the cafeterias in the 60 location. They also launched an app, it's called Health and Me, which helps the employees. It's a free app to count their steps, count their calories, how many hours they sleep, and give them tools to manage their well-being. They also have a program called Enhanced Energy for Performance, E4P, which basically educates employees and managers around the world about how to use good diet, how to do physical activity every day, how to manage your stress, how to sleep properly. And so in that way, it's another tool, very effective and potent tool to help employees manage their well-being. And so this program has been very, very successful. And the result, Johnson & Johnson reported $2.5 billion saving for the period between 2010 and 2020, and a whopping ROI, return on investment, of $2.71 for each $1 investment in this program. How did they manage to achieve such, I would say, staggering results? Well, basically, they were able to lower the incidence of sicknesses like strokes, like hypertension, and other diseases. They were able to reduce the number of sick days and absenteeism, and increase the motivation and the well-being of the employees and company loyalty. And the bottom line was reduction in employee turnover, which again helped them to save a lot of money. So the bottom line of this example is that well-being is a win-win equation for both employees and their families, as well as for the company bottom line. So as we say, well-being equals better life, and better life equals better success. Thank you.
Thank you very much, Chaim, for this wonderful introduction. Let's now go and dive into the standard. And with us today, we're honored to have Ms. Kate Field. She's well known around the world for her advocacy and for this standard, the 45003. And she is the global head of health, safety, and well-being at BSI. Kate, the floor is yours. And I would like to ask you the first question. Can you please tell me, what is ISO 45003? What is the cover? And is it or is it not linked to 45001? There are a lot of questions about it. The floor is yours.
Lovely, thank you. And I'm delighted to be here and have the opportunity to talk about 45003, as you said, something that's very close to my heart. So ISO 45003 is a standard that was published a couple of years ago now, in the summer of 2021. And it is a guidance standard, as all standards are voluntary, but this is a guidance standard that is really focused on psychological health and safety in the workplace. I think, we heard beautifully presented this explosion that there has been in terms of looking at well-being and what that means within the workplace. And I think a lot of organizations, as you heard there, have done some really amazing things thinking about kind of personal well-being and societal well-being. But there is kind of a really big gap in terms of understanding workplace well-being, and a lot of initiatives within organizations have limited impact because they fail to address kind of the biggest barrier to workplace well-being, which is psychological health and safety. So this guidance standard is really designed to plug that gap. It's an easy to use, practical guide for anybody working within an organization, whether that's a health and safety professional, whether that's an HR professional, whether it's a line manager, to really start to understand what are these work-related causes of particularly mental ill health, so work-related stress, work-related depression, work-related anxiety, and really start to take proactive steps to address those. It is designed, like all international standards, to support sustainable development goals. So in particular, good health and well-being, kind of the more general societal level, but looking specifically at the work level, SDG 8 around decent work, as well as supporting other SDGs, particularly around sort of gender inequality and general inequality. So you asked the question about how it links to 45001, which is a great question. And they're designed to go together. So the way I tend to explain it, and people on this call might not necessarily agree with me on this, but 45001 is the parent or umbrella standard. So it's the overarching standard for occupational health and safety management. And then under that, you have child, or if you like, sort of sub guidance standards, and 45003 is one of these. So it's designed to support and complement 45001. But the reason the International Committee decided to write this guidance standard was 45001 is your core occupational health and safety management system. And although it does make some reference to thinking about cognitive impacts, when it talks about hazard, it does mention some psychological hazards, psychosocial hazards, risks. It doesn't go into the depth, and there was a recognition that, you know, it is the depth of knowledge that people really lack, which is why the committee decided to write this supporting guidance standard to really help organizations go through and understand what psychological health and safety is. So it's designed to go with and complement 45001. But if an organization doesn't use 45001, they can still look at 45003 and look at the guidance around psychological health and safety. So they can be used together is the best way to use them, but they can be used separately as well, which is fine.
Great. I got a lot of questions about it, and it's very interesting. But is there a difference between organizational and individual approaches? And what competency do you need?
Yeah, so I think this is really important. We heard a lot of well-being programs within organizations focus on the individual. You know, they focus brilliantly brought to life. You know, they focus on encouraging healthy eating, improving exercise, so very much focus on kind of individual interventions to help personal well-being. 45003 is really focused on what the organization needs to do. Just like any health and safety hazard, they can be created by the organization, and therefore the organization needs to take steps to mitigate or eliminate them. And perhaps it's easier to bring it to life if we talk about a hazard we're all familiar with, which is fire. So if you think about fire risk within an organization, the organization has to understand what the risk of fire is, where a fire could start, how it could spread, and then take organizational level action to either eliminate or mitigate that. So they'll put in a fire alarm system, they might put in a sprinkler system, there'll be fire extinguishers, there'll be fire doors. So those are all organizational level actions that the organization is taking to minimize the risk of fire. Within that, there'll be processes for evacuating people if there is an actual fire. And for most people, they'll be able to follow the same evacuation route as everyone else. But there may be a few people who might need additional support to evacuate. So we have a personal emergency evacuation plan. So they might have limited mobility, they might be heavily pregnant, or you might have people who can't hear a noise-based fire alarm, so they need a visual-based fire alarm. So the organization has to look at the organizational risk, manage the risk, and then adapt it if needs be at an individual level. And it's the same when we look at psychological health and safety. There are key risks that are created by the organization. The obvious ones are culture, driven by the leadership, but things like poor career development, bullying and harassment. You know, there are organizational psychosocial risks, which I'll come back to in a minute, that the organization can take steps in a prescribed way, following a hierarchy of controls, to either eliminate or minimize those risks so that people aren't harmed.
Thank you very much. This was very interesting. Let's turn now to you, Chris. Chris is the head of safety operations at Amcor. And Chris, we would like to know a little bit about your company and why did your company decide to implement the standard? I think you are among the first ones to implement, if I'm not mistaken.
Yes, the first ones globally, and we can thank Kate an awful lot for working with us in order to get there. So it was a huge achievement for us, and to pick up on some of Kate's points about the whole alignment, which I'll pick up in a little bit later. But Amcor UK, so we have about 3,500 employees. We're an asset and facilities management company in the UK. In effect, what we do is we work with a diverse and sometimes highly regulated group of customers, where we would put or place a number of employees into those customers in order to outsource their facilities and asset management. So you can imagine it's quite disparate with regards to the organization. We have central functions, of which I'm a part as head of safety operations, but we also have safety, well-being, technical, a number of competencies, hard services, soft services, all going into some, as I say, quite highly regulated and working environments. Some of them can be quite difficult and challenging environments. So health, safety and well-being, and I'm going to talk about these and follow on very much from where Kate, and I totally agree exactly with what Kate has just said. So we put both of these, we place both of these 45,001 and 45,003 standards together. So what I'm going to talk about now and our adoption is very much aimed at that. So I joined Amcor in the end of 2021. I've enjoyed every minute of my time here. One of the first parts of Amcor that I really bought into was it's very people-centric. And from a health and safety professional who's been in this profession for longer than I care to imagine at the moment, but for most of my working career, health, safety and well-being is about people. So as we talk about health, safety and well-being, we talk about it in one area. So it's going to be just one theme right the way through, and that's the reason why we adopted it. So clearly evident through our leadership commitment, and Kate again mentioned, that is paramount, and it's is fundamental to how we create a culture in our organization and how we can affect our management systems. It's quite fundamental, that leadership commitment, and we have that here in Amcor with our senior leaders very much endorsing and promoting health, safety and well-being in everything that we do. We can evidence that through our alignment to our global goals. We can evidence that through our purpose, our values of people who care and safe and secure together as one, and active and ambitious. And then that flows all the way down through the whole theme into what we call Be There for Life. And our Be There for Life cultural program, which takes into account everything from a physical and a psychological aspect. And that derives something we call the whole person approach. I'm getting there, Varid, I can assure you, this is our whole person approach, is our amalgamation of 45,001 and 45,003 together. So by going for 45,003, by achieving 45,003, it's simply just underpinned what we already had from 45,001. It gave us that psychological aspect, that risk-based approach to psychological thinking, just to add to the physical side. So it really is just one standard for us. Since we've taken it on board, since we adopted the standard, we've now created one policy. So instead of a health and safety policy and a well-being policy, it's just the singular policy. If we do anything with regards to from both a proactive or reactive stance, it's taking into account both physical and mental well-being. We were the first company to attain this, which is very, it was quite prestigious for us. We did have the 27,500, the human-centered approach, which we also endorsed, but from a framework. So that was also in place. And again, as Kate said, 45,001 identifies our organizational responsibility for occupational health and safety. 45,003 simply just underpins that risk-based approach in order so we can then focus on both the mental and the physical side of occupational safety, occupational health and safety. And it's something that we're on a journey. It's still something that we have to mature, and we'll keep on maturing as we go forward. But that's pretty well why we adopted 45,003. It was a natural progression as soon as it came out to fit 45,003 direct and amalgamate 45,003 directly into our thinking from health, safety and well-being. If that hopefully answers your question.
Yes, it does. Very interesting. When we previously discussed, the two of us, you were talking about the committee that you're leading and the lecture that you gave about sleeping, and I was really curious. Can you give us more example, or even this example? And how do you implement it at your company? Give us specific examples.
Okay, so so as part of our well-being community, we have, if we take into account the standard itself, the full needs and expectations, understanding the needs and expectations from both a physical and a mental capacity with regards to all of our employees, our supply chain partners, all of our interested parties. That's where it started from, those needs and expectations. In doing so, we created a whole community of well-being champions. The well-being champions have a steering group of which I chair, and each of the people, each member of the steering group present on a monthly basis out into the well-being community. Now that might be something that is of an international emphasis, a campaign that might be of the month, like Mental Awareness Month we've just had. In my month, it was sleep. So I won't lie, I attended the Wellbeing Conference in Birmingham, and there was a fantastic presentation on sleep and the effect that sleep can have on well-being. And I was absolutely taken aback by just the correct lighting, the correct going out and getting sunshine, and the correct sleep patterns and what to do just before going to sleep, and all of these sort of things. And it was a game changer for me. So I thought the best thing to do was then to present what I'd learned back into that wellbeing community. So we have about 200 wellbeing champions across our organization, and that just doesn't just span, as I say, from a central perspective, that goes into all of the different organizations that we work with. And those wellbeing champions are readily available to have conversations, to listen. They go through an element of training, mental awareness training. They have a number of aspects, a number of tools that they can use just to simply ensure that people have an avenue, a conduit, in order to come and have those discussions. And then all of that is wrapped around in our frameworks, our 45,000 frameworks which we have. Risk assessments. When we undertake risk assessments are now undertaken. So if we talk about proactively, risk assessments are undertaken both on a mental and a physical aspect. When we talk about how we look at, Kate alluded to or talked about then about PEEPs, and the fire analogy is a very, very good one. We reviewed all of our risk assessments, especially our organizational ones, so that they didn't just take into the fact that an alarm would go off and someone would leave the organization through the nearest fire exit and so on and so forth. These sort of controls have been embedded into our lives for years and years. But what about those people whose reaction to that alarm would be not the same as somebody else's? What about people who might fear those alarms? All of those sort of things would be taken into account. And generally just promoting people to openly discuss that is pretty well much where the wellbeing champions come in. Proactive occupational health in the workplace, creating a portfolio of where somebody goes into an account and the risks that that person might face whilst they're there, and proactively working with them in order to mitigate those risks. Our multi-department collaboration. Now, this is something which derived from our integration of the wellbeing standard. In some companies, you sometimes find that departments might work in silos. If you start to amalgamate and align some of these the standards together, certainly from a safety and a wellbeing perspective, you remove all of those bridges, you remove all of those areas where maybe health and safety and human resources there might be gaps between them, because now we work directly together. We attended a seminar a little while ago, an HSC seminar, Congress seminar a little while ago, which was fabulous with regards to the debate. Now in Amcor, we see health, safety and well-being and the human resources department. We work together on mental. We don't see that as a separate entity because it's all about people. So that's why it's brought us much closer together. Whereas maybe prior to the wellbeing standard being implemented, maybe there was that slightly more gap. I'm not saying there was a huge gap, but maybe it's brought us together. Reactively, it's helped us with our incident management. If I can give you a scenario, if we were investigating somewhere where one of our operatives might have tripped or slipped down a staircase, normally we would have looked at the fact of whether or not there was a spillage, whether or not the staircase was in good conditions, nosings, all of those things, adequate lighting, whether or not there was an obstacle, whether or not something physically influenced that person to move or in a different way or to fall down the staircase. But imagine if we take that person's state of mind in that operation. Imagine if somebody was going to an important meeting, a meeting with their line manager. Maybe it was something where they were worried or concerned about that meeting, and they're now coming down a staircase in a much more different state of mind than what they would normally do. And imagine if that was a causal factor or influenced that person from in order to have that accident. And that's opened our eyes really to now understanding that whole person. So we take that into account, and certainly from our learning from experience. So hopefully that gives you a kind of roundabout way of how we've implemented the standard.
Yes, thank you so much, Chris. I think there's so much to learn. I mean, what we heard from you today is fantastic, and we know that we have a lot to learn. And it's perfect now to move to our next speaker, which is Dalia Rome. She's the Director of Standardization at SII, but she's also in charge of the training center at SII in Israel. Perfectly goes with what you just said right now. And Dalia, can you tell us about the challenges of selling and marketing training courses on this standard?
Yes, thank you, Vered. Well, I think that the advantage of being the last speaker is that I can rely on the insightful presentations of my colleagues. So I think that the answer to your question is quite clear after hearing my colleagues, but I will try to summarize it in 4 main points. So the first one relates to the marketing. It's not like it's not a standard that we are used to market. 45,003 is a voluntary standard here in Israel, not recognized in the market. It deals with a soft area of HR and immediately connected to the management, with the fact that it will require them to spend more money on various welfare items. You know, most of our students don't pay for their trainings by themselves. The trainings are paid by their employers, and if they send them to such a training, then they will have to pay to implement it. So this is the first one. The second is that the target audience is not entirely clear, because I heard Chris and I heard Kate, for them it's very, very clear, but to our safety auditors or safety managers, they don't see it as a part of their role. Please don't mix me with HR things. And I felt a little bit jealous to hear Chris and they explained he explained this dilemma very, very good. And I think that as Kate said, also the standardization committee was aware of this dilemma, and then they created the guidelines. But for us here, it's yet not cut clear. The third point is that we had our only one training, only one experience, and we faced a big diversity among the participants. We didn't target them. So we had CEOs, organizational consultants, quality manager, and so on. So there was a difference between their motivations, backgrounds, the extent to which they know, and they're related to the terms of organizational understanding, and somehow it make it very difficult. There was also a big difference about their understanding of the standardization issue. Even the why standards should handle this subject was quite a dilemma for them. And while there were some students that it was obvious, so the diversity was too big. The participants that came from the quality areas had knew the language, they had better understanding on the structure of the standards, but to the other, especially those that are coming from the HR area, it was completely new. And the last one, the fourth one, is that it's not only the variation between the students, it's also the variation between the organizations that the participants belong to, like businesses, private, public sector, small and medium, large organization. And this difference has created a lot of challenges in adapting the content of the training.
Thank you. So how would you, what can you recommend? What can you recommend? How can you do it a better job in the future?
So hearing the experts, I feel a little bit humble to recommend, but I can just describe what we are doing now. First of all, we have decided not to give up. We want to try and to improve our performance, but we should have trainings on 45003. We think and we believe that it is a very, very important standard, and we should explain that it really goes together with the 45001. We also contact our colleagues, other training centers, and we're trying to learn from their knowledge. I think that sharing knowledge is one of our advantage as standards makers. And in order to overcome the problems that we already defined, we decided to offer this training together with some explanations. I think that after hearing Kate and Chris, I think that we should focus that on the knowledge that 45001 and 45003 goes together hand by hand, and this should be clarified before we offer the training. And we will bring this information to our potential students. And we also decided to focus on small and medium enterprises, because some of the big companies have programs already as part of their ESG programs, for instance. They have programs on well-being, so we will try to focus on small and medium enterprises. And we are open to any other idea from the audience of this webinar. We really want to spread the knowledge on this important standard.
Thank you very much, Dalia, and thank you all of you. Thanks everyone for joining us today. I think the four speakers had great contribution to the understanding of 45003. And if anyone has any more questions, we'll have all the information, all the contact information in the slide just when we finish this webinar. Thank you, everyone. And I hope you enjoyed it and learned as much as you can. Thank you.